If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. This is the finale of our 8th season, and we have a great panel ready for you. There are 2 ways to get your questions through. First, by calling in tonight. Second, by visiting our website at netny.net/askthedoctor. I'll take those questions for future discussion or for my video blogs, so keep tuning in. For this episode, I have Dr. Catherine Economos, gynecologic oncologist at New York Methodist Hospital. Next to her, I have Dr. Emil Bakash, medical director at Bishop McGovern Center for Geriatric Care. And then we have Dr. Jeremiah Gellis, cardiology attending at New York Methodist Hospital. Welcome. Well, it's been a busy week in the news. It's been a week of celebrity health issues. And one of the most striking of the week was what happened, the tragedy to Michael Jackson. And I think there are things that we can learn from this. While we don't know what the final diagnosis is going to be, what the final cause of death was, we do know that there was an abuse of medication, that there were several pills being taken that in themselves each one is dangerous, but when you put them all together, they become multiple times dangerous. And that's a problem because you may not even realize you take a sleeping pill, then you take a painkiller, and then you take an over-the-counter pill like Benadryl, and the next thing you know, you can't breathe. The body is suppressing the breathing, and unfortunately you die. And this is accidental, and I think a lot of it comes about because doctors are quick to give out the medications to the patient and may not always know what other medications the patients are on. Then you also have the patient that goes from doctor to doctor and doesn't tell what medication he or she is on. So it's a 2-way street, but it's a problem that we have to address. So anybody out there with a problem with pain, with drug addiction, it's important to get into pain management or drug addiction programs so that we don't have more tragedies. Second, of course, was the swine flu. And that's been a tremendous story throughout this season. And one of our own places, St. Francis Prep, was at the spotlight, really for the world in swine flu. And the way that they handled it, the way the principal and the nurse and the students handled it was exemplary and something that we could all be proud of and show that a bad situation can still be ameliorated in such a way with the proper planning. And we really have to give our congratulations. Yet we're a little fearful that the swine flu is now beginning to change or mutate. We see some cases now in Europe where the swine flu doesn't respond to Tamiflu, which has been the medication used to help to fight it. And this could be dangerous because if it's really changing, it could be changing into something that's very serious that could cause a lot more deaths than we've had. And it's incumbent upon us, therefore, to develop a vaccine so that we can protect ourselves, because that seems to be the most effective way to keep people safe in the swine flu era. So we'll see what happens. I know several companies are working on it and something we have to be watchful. Strokes could be a terrible thing. Anybody who's had family member with a stroke knows how disabling, how it affects the entire family. And I'd like to present something, a way that strokes can be discovered without having to do invasive procedure, without having to cut, without having to put needles in place. And this is something called the Doppler, and it's a technology that detects a blockage before you even have symptoms. I'd like to show you a little clip that we filmed a little earlier tonight. I talked to Miliana from S Group Express Mobile Ultrasound Company about this test. Why don't we take a look at the video and then we'll talk when we come back. In the past, to see the arteries going to the brain, we needed to put needles in and there was bleeding and people were afraid of this. You have a procedure that I know you bring to the doctor's office to evaluate the arteries going to the brain. Tell us a little bit about that.
It's a very simple test. We'll use a little jelly or cream if you don't have a jelly. And we put a transducer on the base of the neck. You'll see the artery here. You'll see nice flow. It's represented now, in this case, in red color. And you see how it's carried to the brain. This flow is going towards the brain.
And what happens if it's blocked?
If it's blocked, you would not see any flow.
And that means you would have a stroke.
Yes, it's a high risk for stroke.
In addition to not knowing who's at risk for stroke, because it could be anybody, people with diabetes, people with high blood pressure, people with heart disease, people with high cholesterol and high triglyceride, smoking, we can't leave that out.
Yeah.
So if you're in any of those categories and you're over 50 years old, you have to demand from your doctor that you be referred to a center that does Dopplers. The name of the exam, Dopplers, Dopplers. And Miliani, I know, does this with her group and in various doctor's offices. You can get it, but it must be done by a credentialed place. Very interesting and very important for all of our viewers. We know how devastating a stroke can be, and this is something that can often be prevented. And finally, really hot off the press, maybe about 10 minutes, a half hour ago, the FDA ruled that Tylenol must make changes in the way they label their products. And the reason for this is that Tylenol is now the #1 cause for liver failure in the country, #1 cause. And part of the problem is that Tylenol is found in other drugs that people don't realize, for example, NyQuil or Theraflu. So you end up taking Tylenol, and then you take the Tylenol that's in the Theraflu that you don't know is there, and you exceed the level. And this is a big problem. So you're going to see changes, big warnings on the Tylenol packets. They're going to lower the maximum dose. There's not going to be any more extra strength Tylenol, and this should be happening very shortly. So you heard it here first. Well, we're ready for our quiz, but before we get to that quiz, I know we get a lot of people, you know this is our last show, so we've had the festivities, the pre-show festivities, which we couldn't bring to you at this time, but just some of the excitement that occurred. The first caller award, you know how we have that first, who calls in first, went to Madeline Mara, with honorable mention to Joel of Massapequa and Lewis from the Queens. It was quite an event. She was overcome with joy. Our youngest loyal listener went to Joseph Scaramuccino. He's age 11, a future plastic surgeon, a brilliant boy in Queens. The Perfect Attendance Award, Monsignor Bennett. How could you compare? 8 seasons, Monsignor, never missed a show. I know we thank you and we hope you enjoyed that plaque. And the longest distance caller was Larry from Rockland County, which was, again, there was a lot of fun. Next year I hope to film it, if possible, from our studio here. But we want to thank you all. And before we get to this really exciting show, let's talk about the quiz, because we have a tough one that our puzzle master, Eugene Hagawara, who's now in San Francisco doing a fellowship in interventional radiology, but continues to send it by courier. So it's amazing. Question: what word can be written forward, backwards, or upside down and still be read from left to right? Okay, what word can be written forwards, backwards, upside down, and still be read left to right? If you know that answer, call us, because you can win that all-important plaque, that handmade imported plaque from Japan, which you have many people working on, and you'll really enjoy that. So let's get to our break, and when we come back, we're going to be taking your calls and listening to your quiz answer. The number is 718-499-6101. You can call and talk about female cancer, geriatric medicine, or cardiology. We're taking a short break. When we come back, we'll go right to the phones. Phone number again is 718-499-6101. We'll be right back. Welcome back. And before we meet our guests formally, let's see who won this week's first caller. Is it going to be Madeline? Is it going to be Joel? Hello? Hello? I have a feeling it's going to be Madeline.
It's Madeline.
I knew it was Madeline. You always miss that 7-second delay. Maddie, turn down the TV set. Maddie's watching a different show, I think. Maddie?
Yes.
What's your question tonight?
I want to know why I get up in the morning. Yeah, I get up in the morning, my nose runs like water, and then I take a couple of those little pills, Zyrtec, and then I feel dizzy.
All right, I'm going to go right to Dr. Bakish. Dr. Bakish, Maddie is a senior citizen with runny nose. And
sure. Runny nose is often caused by something called vasomotor rhinitis. It means that the blood vessels dilate in your nose in the morning and it runs. It can be also caused by allergy to dust or other allergens, mold, or anything like that. Zyrtec, although it's a very effective drug, it has some anticholinergic properties, which basically means that it blocks acetylcholine as well as antihistamines, and it can make you feel lightheaded. So you got to be very careful with taking those types of drugs. I think a better choice might be something weaker like loratadine, which is generic Claritin. It's also called Alivert. But even then, basically, unless it really bothers you, you don't even have to take any medication at all. You might also have allergies to dust, which can be all year round. So that
So,
would be
Maddie?
my suggestion to you.
Maddie, so just
How
maybe...
about Tylenols? I take 2 Tylenols.
Well, Tylenol recently has become problematic. I guess we'll talk about that in a little
I'm
while.
not going to take them anymore.
No, you could take them. It's perfectly safe pill, but just don't take more than recommended on the package. Okay?
Okay.
Maddie, have a great summer.
Yeah, thank you.
We'll see you in the fall.
Okay.
Let's go to line 2 now. Hello, Rose.
Yes,
Hi, Rose. You're almost the first caller.
yes.
Have you ever been the first? I don't think you were ever first before.
No, sir, I never called.
No, not this time either. What can we do for you?
Who am I speaking to?
This is Dr. Garner.
Dr. Garner. Well, I am 63 years old,
Uh-huh.
and I have multiple medical issues. I am a diabetic,
Okay.
high blood pressure, COPD, CAD, and last year I was diagnosed with CHF. I was intubated.
You have all these initials. Let's just, COPD is lung disease.
I know, I am a nurse.
No, but I want the listeners to know. So CAD is what?
I have COPD,
That was the lung disease. How about CAD?
CAD,
That's heart disease.
yes,
And what? And CHF?
CHF,
That's heart failure.
yes, and I have high blood pressure, and I am a diabetic.
Okay. What's your question?
Question is, I'm also a smoker.
Oh, that's not good.
I know, and my problem is I called up, we have here the 311, call for help. I told them the story, they sent me some pills, and before I even started to take them, I read the labels, and it said loud and clear that if you are a COPD or a CAD patient, do not take it. So I called them back. They sent me the patches.
The
And
patches. Okay.
Yeah,
to start.
and the patches have the same thing on them.
Mm-hmm.
If you have any heart disease or any high blood pressure, do not take it.
So, Rose, I want to ask, we have our cardiologist, an internist, and female doctor. Let's go first to the cardiologist. What do you think about the patch for smoking and heart disease?
I think if you genuinely stop smoking and use the patch, you're basically replacing the nicotine in the cigarette with the nicotine in the patch, and it's probably okay if you eventually wean yourself off the patch. But if you continue to smoke and use the patch, which many people unfortunately do, it's obviously not a good idea.
No, I didn't even use the patch because on the box it
Right.
says,
It says don't use if you're heart disease patient.
yes.
Let me ask Dr. Backish what he thinks of that.
Well, I think that's great that you respect those warnings that are on the medication, but there's also a warning on the cigarette pack that has a little black box on it that says
Yes,
the same
I
thing.
know, doctor.
That don't, but you can use the patch as long as you use the proper dose. It comes in, I think, 3 different strengths. So depending on how much cigarette you smoke.
I smoke about 10 cigarettes a day.
So you would use the lower one. You know, I think I would
I
use the
tried
low-
to stop cold turkey, and what happened was, needless to say, that I gained a few pounds, but I got so agitated that my blood pressure went up 200 over 102.
Well, the doctor can give you something to calm you down during that period of time where you're going through withdrawal, but the withdrawal only lasts for 2 to 3 weeks. And then after that, you won't have any more symptoms of that agitation. You will gain probably 10 pounds if you eat the same amount of food, but that still doesn't negate the benefits you get from stopping smoking.
Rose, thanks for calling. Where are you calling from?
From Flatbush.
Good. Keep calling. We'll look forward to hearing from you in September, and you'll be telling us you stopped smoking. All
I
right?
appreciate that, doctors. God bless you.
Thank you.
Bye-bye.
Bye. Up. Now, that was something. So Madeline continued her domination of the first call. And now let's meet our guests, because we have a distinguished panel for you. For our season finale, we had to have one of the top panels that we have. So first, Dr. Catherine Economos. Economos, you've been with us a couple of years ago?
About 2 years ago, right?
I know, and Dr. Economos is a gynecological oncologist.
Correct.
Explain what, it's too hard. What is that?
That's a gynecologist that's done residency and fellowship training to super specialize in treating specifically gynecologic cancers as opposed to doing obstetrics and general gynecology. So it's someone who is completely trained to deal with the surgeries, the chemotherapies, and also help direct the radiation therapy needed for patients who are afflicted with gynecologic cancers.
Does that include breast or just uterine or cervical?
That will include the ovarian cancers, the uterine cancers, cervical cancers. Historically, breast cancer has been treated by breast surgeons. So while we examine breasts and we might find a breast cancer, we don't treat them per se. We treat the pelvic organs, the cancers in the pelvic organs.
And now your specialty is very rare, right? I mean, I don't think we have, how many in Brooklyn?
There's about 6 of us in Brooklyn, but there's only about 1,000 of us nationwide.
Which is really, it's amazing.
Right, it's very few.
We're lucky to have you. And I know a lot of people out there have questions about uterine, ovarian cancer, a lot of fears. What kind of pre-test, what should they do to prevent it? Is there any tests? And we'll get into those questions. And what are you going to do? Anything good for the summer planned?
My family is from Greece, and so is my husband. So we're going to Greece for 3 weeks, so to visit family and have the kids
very nice.
See the homeland.
Beautiful,
yeah.
Beautiful. And Dr. Bakash is one of our most popular guests, been back several times. And I know you look like you got some good color.
Yeah, I was playing golf. So
very nice. How'd you make out?
I did okay.
Yeah.
Not bad.
So any plans for the summer?
Well, I plan on going to Long Island, playing some golf. We got a new dog, so we got a standard poodle. So the puppy, the beautiful
What's
little
the name?
puppy, Abby.
Okay, we'll give a little shout out to Abby.
Abby.
Yeah.
Hi, Abby.
Very nice. And tell them what a geriatric doctor. Just I'm sure most know, but just in case they don't, what does a geriatrician see?
A geriatrician is a doctor who specializes in the treatment of older people. You know, basically patients above 60. They're internists, basically, that are subspecialized in the care of the older people, which are the healthy old people, people that are acutely ill and suddenly ill, and people who have chronic diseases. So we treat people of all ages after the age of 50 or 60, basically.
Very nice. So a lot of questions out there for Dr. Gellis. I know we have a lot of emails that I'm going to be also bringing up. Dr. Bakash, now Dr. Gellis, who's sitting there. I see you brought something along with you, which has become a fixture when you come to us.
Yeah, I brought my heart model. But, I'm going to make an appointment to see Dr. Bakash because he said older people are over 60, and I just turned 68.
That's amazing. That's amazing. Look what makeup does. No, I'm kidding. But and I understand you were playing tennis tonight.
Yes, I was playing tennis, but it was rained out.
Now, that's amazing. You play at the Knickerbocker Club. Tell people if they don't know what that is.
Well, the Knickerbocker is a 100-year-old field club in Flatbush. It's now surrounded by apartment buildings, but there are 5 Hartrue courts, clubhouse, and 140 members who are a lot of fun to be with and a lot of fun to play tennis with.
Excellent. I know I see your wife all the time in Prospect Park running around.
She's also a tennis player, yes.
Excellent. So we really are excited about having you here again, and people with heart problems, questions about medications and so on. So I think we better get right to the phones. I'm not going to hold up anymore. We're going to go to Joe. Joe?
Oh, hi, Dr. Garner.
Joe, how are you?
I'm good. I can't believe it's the end of the season so fast.
I don't know where it went to. Yeah. We're going to be in season number 9, which pushes ahead of The Man from U.N.C.L.E., Addams Family, Leave It to Beaver, all these great shows. We've exceeded now.
Congratulations. A big honor.
Thank you. And what can we sound like you got a little cold there?
Yeah, I'm okay. I have a question about I do have a little cold, but my mother, she's been having trouble sleeping lately. She's, 72. And she just doesn't sleep as well as she used to sleep. She's pretty healthy. She's got a little AFib, but I don't know what's going on.
Maybe Dr. How old is she?
She's 72.
72, Dr. Bakash. People that are older have trouble sleeping?
Many times patients who are older complain that they're not sleeping very well, but they actually sleep differently. What happens is that they tend to go to bed early and they tend to wake up earlier. You spend more time in bed, but if you measure the amount of time that they're actually sleeping, it's usually about the same. There are sleeping aids, but there's sleeping habits that one must pay attention to also. You should try not to drink a lot of coffee or anything that would stimulate you prior to going to bed. You should also try not to engage in activity that's very intense prior to going to bed. You should be sufficiently tired, which if you increase your physical activity during the day, you might be more fatigued. And there also might be some medications that she might be taking if she does have atrial fib or some other medical problems that could cause insomnia. Sometimes some of these medicines have that as a side effect. But there are sleeping aids. It's best not to add more medication if you don't have to. And I really don't like to add a lot of sleeping pills to older patients because it increases their risk of falling. And falling is a big problem in older people. They trip on the way to the bathroom in the middle of the night. Then it starts a cascade of events which are all negative, like breaking your hip and such. So it's not always a good idea to use sleeping medication.
So I hope that answers your question. That was a comprehensive answer.
It does. I appreciate it. And I don't know what I'm going to do on Tuesday nights for the next 8 weeks.
Well, you can still watch reruns, the Best Of show.
Oh, okay, I will.
We didn't quite have enough of Best Of to make the whole year because they weren't all that good. But you'll watch some of them, okay?
All right. Thanks a lot.
Okay. Before we get to John, I got Dr. Economos next to me, and I know one of the biggest fears of women is ovarian cancer. And it seems like there's no way to tell who's getting it, and oftentimes it's diagnosed at a late stage. Anything new out on the horizon for getting these women to get in at an earlier stage when they can be treated?
There aren't any tests that we've come up with, but the most important thing is for women to recognize the symptoms. It's not an asymptomatic disease, nor is it a disease that has distinct symptoms. So unfortunately, the problem with the disease is it causes symptoms that are more gastroenterological. So it'd be typical for example, bloating, maldigestion, not being able to eat as much as you're used to eating. Other distinct symptoms that have come up that are identifiable are changes in your urinary habits. If you feel like you have a bladder infection and you go to the doctor and they test your urine and they don't find an infection, but it feels like you have an infection, if you have some burning, some pain with urination, that could be a sign also. So the important thing to know is if you have an abdominal problem, be it with your appetite, with pain, with bloating, and when I say bloating, I mean bloating that is not typical of when you have your period for 2-3 days, but a distinct bloating that causes you to almost feel as if your belts are tight or your skirt is tight. That's something that you need to address with your either your gynecologist or your internist. But if you go to your internist and he or she doesn't find a reason for the bloating after about 2-3 weeks, then one has to start thinking about it possibly being a sign of ovarian cancer. And the same with urinary symptoms. If that can't be explained within 2-3 weeks, one has to think in the back of their mind that it might be ovarian cancer.
So it's a very important message for the women out there. Don't waste time, because the sooner you get in, the better the chance to live. Let's go to John on line 4. Hi, John.
Yes, hello, Dr. Garner. How are you?
Where are you calling us from?
I'm calling from Brooklyn, Kensington. It's right off Ocean Parkway.
Not far. What are you planning for the summer? Anything good?
Not really. I got 2 weddings coming up.
Oh, nice. For your family?
My daughter's getting married in late September.
Congratulations.
And my son is getting married 2 weeks later.
Wow, that's great. Is that it?
It's going to tie me up pretty much for the summer.
The 2 of them, are you all done, or you got more to come?
I got 1 more.
Right, very good.
He's already talking.
Very good.
I'll be busy. We'll be busy, me and my wife.
I'm glad. Congratulations.
Thank you, Doctor. Thank you very much.
What can we do for you?
You know, Doctor, I have a question. I feel bad. My cousin, he's 66 years old.
Yes.
He was just rushed to the hospital Friday. He went to Staten Island University Hospital, and they took him in, extremely dehydrated, was the diagnosis that night. He had sciatica problems. He's been in bed for about 10 months or so. He just had a hard time getting out of bed. He had therapy. Now he was rushed to the hospital. They said extreme dehydration on Saturday. This was this past Saturday. Sunday, they told his wife that he had a stroke. And this wasn't his first one, and they can't even remember the first one. And now Sunday afternoon, they wanted to put him on the table to operate because they found a leaky valve. But then they decided yesterday that he's too weak.
How old is he? How old is he, John?
66.
60. I'm going to ask Dr. Gellos to jump in here.
Yeah, I was wondering if there was some kind of medication to give this instead of surgery or whatever.
Well, this sounds like a very complicated case, and it's not completely clear what's going on. It's a little strange that in the scenario that you just presented, they would suddenly decide to do open heart surgery. He seems to have a lot of problems that have to be resolved before they do open heart surgery. And actually, nothing that you've described clearly indicates what the heart valve problem would have to do with the other problems that you've described.
He was a big smoker, doctor. He was
Well,
a pretty good smoker all his life.
I mean, that's just another complication in the whole picture.
Yeah.
But if he came in with dehydration,
Right.
and then he had a stroke,
Mm-hmm.
I'm not sure, although we could talk at great length about what the relationship is between heart valve problems and strokes, it's unclear to me how that would relate to him. And also, it's unclear to me how operating on his heart valve in the midst of a stroke and all the other problems you've presented is going to be helpful.
So, Dr. Gill, you're leaning towards a medical approach to this case.
Right. Now,
Well,
is medicine or anything?
one of the things I'm leaning towards is we need a lot more information to really discuss this situation intelligently.
John, it's a very difficult case, but clearly he's a surgical risk. So it's something you really need to discuss very carefully with whoever the physician is suggesting. And you need to bring up these questions about the valve, about the smoking and the risk, and ask about alternative treatments. That's what we always stressed. Always never take the first approach without asking the questions, okay?
Right. I appreciate it.
Congratulations. Let us know how everything went.
Doctor, I will, and I can't wait till you come back in September.
Thanks a lot, John. Take care.
Thank you, doctor.
We got another John, a popular name for tonight. John.
Hello.
Hi, John. How are you?
Hey,
John,
how are you, Doc?
Hey, good, John. Turn off
I'm
your...
all right. First-time viewer, new viewer, actually, and first-time caller.
Oh, can you turn off the television?
Okay,
I'll wait.
I'll wait. Over to the next room.
Okay.
Okay, my question, Doc, is I've been suffering from these dark patches under my arms and, like, almost in between my legs. And I went to see a dermatologist, and he gave me hydrocortisone, but it didn't seem to work for me. And actually, it spreads more. I would like to know, is there anything else that I can use or an advice that you can give me that I can take care of the problem?
Sure, man. I want to ask Dr. Backish to start off with that one.
Sure.
These rashes under the arm. And
Yeah, dark patches under the arm can be due to several different things. It can be due to a fungal infection, which is a common thing, or it can be due to a condition called acanthosis nigricans, which is associated with internal organ problems. But if it's a run-of-the-mill problem, which is what most people would have, it's probably a yeast infection. And if it is a yeast infection, hydrocortisone is not a good idea. But all it will do is it'll temporarily give you some relief. But drugs like clotrimazole or miconazole, these are drugs that are used. Yeah, you get it in a drugstore. These are used for athlete's foot, but you can use it. You can use it under your arms. But
yeah, because like I said, it's a problem that's persistent. And not only that, the way it just changes the color of my skin, it gets like very, very dark.
Right. Well, if you use hydrocortisone over 2 weeks, it will hyperpigment your skin. It's not a good idea to use steroids on your skin. You get steroid dermatosis, which means that the skin actually thins out, and you get these little tiny blood vessels, like they're called telangiectasiae, and it pigments the skin dark. So stay away from cortisone or any steroid creams, and try the antifungals. And if that doesn't work, you got to see the dermatologist.
John Lotrimin is the name. I think you'll find that.
Lotrimin. Yeah. Clotrimazole.
I have one more question for you, Doc, before I go.
Sure.
A friend of mine has these things that's coming on his neck. They look like little balls, like little meatballs. Like.
Yeah.
It's hard to describe them.
Those
I don't really know
those
the
are
name
called
of them.
acrocordon. acrocordon. They're basically skin tags.
Oh, how do you get rid of
and
that?
They can be fibromas. It depends. Fibromas are harder. Skin tags, they can be removed by any surgeon or dermatologist. The old-fashioned remedy was to tie a string around them just to take off the blood. I wouldn't do that, but you can just see any doctor can just cut them off.
Would jewelry have anything to do with that? Because he wears a lot of jewelry.
No, people get skin tags without relationship to jewelry. Jewelry can cause redness if they're allergic to the plating or the gold or the silver itself.
John, thanks for calling. How'd you find this tonight?
Hey, Doc. Oh, great. Excellent. Like I said, I'm a first-time viewer, and I'm definitely going to keep on watching. I think you guys have a great show.
Thanks a lot.
Keep it going.
Thanks a lot, John. Take care. Suzanne. Hi, Suzanne.
Yes. Hello.
How are you, Suzanne?
I'm good, thank you.
Hi, where are you calling from?
I'm calling from East New York in Brooklyn.
Oh, not far from us. You have anything exciting planned for this summer?
Well, my son's tuition, he's going to college. I have to pay for that, so that's exciting.
That's exciting. Which college?
John Jay.
Beautiful. What's his name?
Christian.
Christian, we wish him good luck.
Thank you.
And John Jay's in the city, right, on the west side of Manhattan?
Right, 59th Street.
Beautiful. He's going to be a police officer?
No, he wants to do forensic science.
Forensic. Very interesting line of work. It'll pay off the hard work, right?
Yes.
So what can we do for you?
Well, I was diagnosed with an abnormal heart rhythm like 12 years ago. By the way, I'm 43.
Okay.
My doctor didn't put me on medication. I had to lay off the caffeine, which the sodas and the chocolate. I did that. Most recently, I went to see a cardiologist, and he told me my heart was weak, and he wanted to put me on medication. So I asked, what is it that I can do so I didn't have to be on medication? Well, he told me to change my diet, and I had an echo, and, everything improved. My question is, for this condition I have, which is an abnormal heart rhythm, can I avoid in the future taking medication for it, or is it inevitable?
Okay, Dr. Gellis?
It sounds to me like you have more than just an abnormal heart rhythm. It sounds like he said you had a weak heart.
Right, he said it was just a little weak.
Well,
they wanted to put me on medication, so I said I really didn't want to take medication. What is it can I do? Of course, I was overweight, so I lost like 20 pounds, changed my diet, and it improved. But I'm concerned about down the line.
How weak was your heart? Did he say your heart was a little weak?
Yes, he said just a little.
Did he explain to you why your heart is weak?
No, he did not.
Well, I think it's very important to find out the cause of your weak heart, even if it's just a little weak, because in order to understand what's going to happen down the line and whether you need to take medications or not, you have to know what's causing this. For example, it can be caused by blockages in the arteries. It could be caused by hypertension. It could be caused by problems with the valves of the heart. So you really have to know the cause in order to know what to do about it and whether you need to take medication or change your lifestyle and so on. It seems to me that you need to get a lot more information from your cardiologist.
So, Suzanne, we need to get that information. You can always go for second opinions. You have Dr. Gellis's number there. You can go to any. It sounds like a second opinion, or at least to question your doctor as to what's going on here. What's wrong with the heart? Why was it weak, as Dr. Gellis said? And that could help us to answer the second part of your question. Okay. So can you get that and you'll call us back?
Absolutely.
Speak to you in the fall. Take care.
Okay.
Before we get to Diane, who may have the quiz, don't tear up your tickets yet at home. I have to. You see, in the phones, we have all cardiac questions and questions from men. In the audience, I have Mary, who wants to know from Dr. Economos. She's 36 years old. Should she continue to have pap smears? She's been always negative.
Up until the age of 30, you should be getting a pap smear once a year. After the age of 30, you can combine a test called the HPV test, which is a detection of the DNA of the virus that is known to cause cervical cancer. And that test can be done in combination with your pap smear. If you have a negative HPV test and a negative pap smear, you can skip your pap smear for 2 years after that and get it again in combination again with the HPV test 3 years later. So you can go to every 3 years after the age of 30 if you've had negative pap smears up until then, and if at age 30 or 31, whatever, your pap smear and your HPV test are negative.
Is this something the woman has to demand, has to ask for? In addition to the pap smear, please give me this HPV test?
It would be a good idea to ask the doctor, the gynecologist, are you going to do the HPV test along with my pap smear? Just as a reminder, most gynecologists do that. But if you remember to remind the doctor, I don't think that's a bad idea. Otherwise, if you don't do that, then you're pretty much advised to do a pap smear once a year in your 30s, well into your 40s and 50s. If you've had negative pap smears up until the age of 70, you've had 3 in a row, and you haven't had an abnormal pap smear during your 60s up to the age of 70, 3 pap smears in a row that are negative and no abnormalities in the 10 years before, then you can stop getting pap smears altogether after the age of 70. So between the ages of 30 and 70, you should be getting a pap smear and your HPV test every 3 years if they're negative.
You know what's interesting? I don't know if the other doctors found this, but a lot of false positives. The women come with a little infection or a little irritation, and the next thing they're getting a call, they're all panicky. Does the HPV test eliminate this false?
That's right, it does. It eliminates the false positive, and it is in many studies thought to be a better test than the Pap smear. But it's hard. We haven't gotten to the point where we are going to just leave the Pap smear by the wayside. It's been a test that's, warts and all, it's been the best test that we've had for cervical cancer until now. And so rather than just eliminate it, we use it in combination with the HPV.
Interesting.
Yeah.
Hope, Mary, that answers your question. Thanks for coming tonight. Now, see, I have Diane may have the answer to the quiz. Diane?
Yes. Hi, Dr. Garner.
There's a rumor here that you may have the answer to this quiz.
I came up with the answer noon.
How'd you come up with noon?
Well, I guess it's my Catholic school training with the Sisters of St. Joseph. All the puzzles that they used to make us do in class. I guess that all paid off in the end.
It paid off. The hard work paid off, right?
Right.
You take the word noon, you turn it upside down. It's noon.
Turn it upside down, forward, backward.
Backwards,
left
forwards.
to right.
Great job, great job. And have you planned where you're going to put this plaque?
I guess in my bedroom. I think in my bedroom.
A lot of people like the bedroom, yeah. And it's going to be worked on. Actually, our plaque maker is Linda Lapitosa, who's in Alaska, incidentally, visiting for a week. So there'll be a delay of getting this plaque. It'll get there in 2 weeks.
Okay.
But it's worth the wait. You're going to be very happy when you get it.
Okay, I'll be very patient.
Thanks. Do you have any medical questions?
I do have a very quick question. I have a 28-year-old son who was last year diagnosed with, they said he actually doesn't have epilepsy, but he keeps having seizures. And they don't want to use the word epilepsy, but yet he keeps getting these seizures. And I'm wondering, you know, I don't know what's causing him to get them. And his neurologist doesn't seem to know what's causing him to get them.
We're going to have a neurologist on next year at the beginning of the season. I'll ask any of the doctors if they want to address that. Again, seizures, difficult topic. It depends very much on the age, and I'm sure he's had a CAT scan and MRI, right? He's had all these tests that are negative.
Right. Everything was negative.
And EEG shows what, non-specific findings?
Everything is everything EEG he had twice in the hospital. He was in downtown, used to be downtown Beekman. It's not that anymore, but he had that done there. And
what
everything
medication,
was negative.
What did they give him to take?
Well, he was taking I can't think of the name.
The Depakote?
The usual one.
Usually Dilantin.
Dilantin.
The Dilantin, but now they gave him something. The Dilantin was making him very drowsy. Yeah. And it was very sluggish.
I think did you get a second opinion already?
Well, he seems to want to keep with this doctor that he has, which I don't really. I'm not thrilled with this doctor, but he's 28 years old. He's not a child. I think I would ask, why don't you ask, the doctor shouldn't mind, ask the doctor to send you for a second opinion, to one of the bigger institutions in the city. I think that would be wise also, but, But congratulations on winning this prize, and you're only the eighth winner. Before we go to Rose, who's on line 4, Rose, I want you to hold on patiently because we have the email questions that have been just tremendous. And the question I have, I won't give the name to protect it, but Frank is the first name. He was diagnosed with high blood pressure, 140/90. My doctor prescribed a drug called Azor. It is quite expensive under my medical plan, and there is no generic counterpart. Can I ask the doctor to change to a generic drug, and are all high blood pressure pills the same? That's Dr. Gellis.
All high blood pressure pills are not the same. However, there are many different high blood pressure pills, and certainly the individual can be prescribed a generic antihypertensive and a generic high blood pressure pill and see if it works. The most important thing is to lower the blood pressure. All the studies have basically come to that conclusion, that it doesn't really matter a whole lot how you do it, so long as you do it. And I want to add that diet and exercise and restricting salt intake is a very important part of lowering blood pressure, and it shouldn't be forgotten. I guess, Emil, Dr. Backus, do you find that you can get the patient a cheaper drug that does the same thing? Oh, absolutely. That nowadays is a reality of practicing medicine because the HMOs have a formulary, and you must stick to the formulary, and they have Tier 1, Tier 2, Tier 3. So Tier 1 drugs are the ones that they prefer. So they're drugs like lisinopril. It's very inexpensive. It's generic, and it comes in a combination with hydrochlorothiazide, which is a weak diuretic. And the cost of that would be, if you paid cash for it, would be like $25 a month.
versus the Azor, which I imagine is upwards of close to $100, or more a month. So there are several other drugs besides the ones I've mentioned. And actually there are online sites where you could put in the name of the drug and it will give you the price of the drug in case you want to double check against the pharmacy.
I kind of wish doctors would take this into account, because if you can, the patients are paying a lot of money and they sometimes don't even want to get the medication because of it. So I think the thinking that Dr. Backash and Dr. Gillis have is, it should be more. We should see more of it. Unfortunately, we don't always. So, Rose, hi Rose, you've been waiting for a while. How are you?
I'm okay.
Where are you calling from?
Sheepshead Bay.
Oh, nice area, right? Beautifully.
Yes.
And what are you going to do? Are you going to hang around Sheepshead Bay for the summer, or are you planning to go somewhere?
No, I'm not going anyplace.
Do you ever go to the beach club? What was that beach?
Palm Shore.
Brighton Beach Baths, Palm Shore?
Oh, Brighton Beach Bath has been a condo for a number of years.
I know. So there's not. Where do most people go now?
Well, I have friends who go to
Silver
Go, which is in Breezy Point.
Breezy Point's a nice. We used to go there. It's nice. Very relaxed.
Go fishing on the party boats?
I'm not a beach person.
Not a beach person. Dr. Gillis wants to know if you ever went out on any of the boats fishing.
Oh yes, and I fed the fish.
Oh, you fed the fish. Very good. Fish. Funny, Rose. What's the story? What's the night? What's going on?
I have a question for my compatriot, Dr. Economo.
Oh, very good.
Gynecologist. I'm 75 years old.
Okay.
And for the past 2 years, on my gynecological annual visits, I was told I have a thickening of the uterine wall, which at my age should be thinning. And I've had sonograms and biopsies, which were negative. And I'm just wondering, why is this a precancerous condition? Is it something I should be crazy about, or what?
How is this? I'll ask Dr. Connor. How would they diagnose thickening of her uterus? Dr. O'Connor I wanted to give an answer. So listen, Rose. Yeah.
Thickening of the uterine lining is actually what you're talking about.
Right.
The muscle has a border, and then on top of the muscle is the lining of the uterine cavity. Ultrasound, using both the transvaginal and the transabdominal probes, allow them to look at the uterus in detail so they can see how thick that lining is. And the outside probe, the abdominal probe, lets them look at the uterus in general and the ovaries as well. Sometimes it's hard for the sonographer to find that border between the lining, the endometrium, and the muscle. And it's then when we think maybe there's some thickening, maybe there isn't. We are able to do the biopsies, as you talked about, in the office to see if there's any pathology. But in the absence of any pathology on endometrial biopsies, you really should go, or ask the doctor if you should go one step further and do a formal D&C, which is a procedure that you're put to sleep with under general anesthesia for about an hour, and the gynecologist actually literally scrapes out the whole lining so that the pathologist can analyze it. In addition to that, we also put a scope in and take a look to see what might be there, like maybe a polyp or an old fibroid. So it's really not enough to just stop at the endometrial biopsy. You need to go one step further and do the formal D&C so that we can
make sure. In addition to the sonogram?
In addition to the sonogram, that's right. To go one step further beyond the biopsies and see once and for all what might be causing this thickening that the biopsies may be missing, because the biopsy is a blind procedure. It's only taking a sample. The D&C lets you scrape the whole lining. So that should be the next step, a D&C and what's called a hysteroscopy, which is the looking in with the scope to see what might be going on.
Rose, so it sounds like we need to do a little bit of work, right?
I'm just wondering, how debilitating is a D&C? I remember having one after a miscarriage many, many years ago, 50-some-odd years ago. And how debilitating is it now at 75 to have D&C?
It's not debilitating for a 75-year-old at all. If you have the D&C, the usual practice is to send you home a couple of hours later, and pretty much you're back to normal the next day.
Rose?
Okay.
I hope that helps you, and have a great summer. Did you eat at that Greek restaurant in Sheepshead Bay yet?
Yeah, Yasu, no. I'm Greek, and Yasu is not a great restaurant.
Which is the best?
You go to Astoria for a good Greek restaurant.
What about the one on in Brooklyn Bay Ridge, that in the corner store? What's the name of that place?
I know my kids went there and they didn't like it.
Not Mezze. I liked it. There's other places I'll think of it anyway. But
we go to Samatis in Astoria, which is great.
Very nice. So be well, have a great summer, and get this workup, okay?
Thank you, doctor.
Let's go to Linda. Hi, Linda. Linda?
Yes.
How are you?
Hi. Thank you for taking my call.
Sure. Where are you calling us from?
Bath Beach.
Oh, Bath Beach. Not many restaurants out there, huh?
No, we have to travel just a few blocks up to Bay Ridge.
To
like 30th Avenue, or there's a lot of little restaurants there. 5th Avenue. I go to 101 with my kids.
101, yeah, it's a nice place. And what's that? Yeah, and Tuscany Grill, you ever go there?
Say that again?
Tuscany Grill, a little place on 77th and 3rd.
I haven't yet.
Nice place, you'll enjoy it.
Thank you.
What can we do?
Thank you. I have a simple question. I have, I'm in good health. I'm 62. I'm going to turn 63 in another month. I have arthritis in my feet, in my right foot in particular.
Okay.
And I want to know, is there any way that this can be reversed or healed?
Arthritis in the foot. And we were going to have my brother, rheumatologist, Dr. Bruce Garner, on the show, who took ill right before the show. But we're going to have him on in the fall. But the question is, an arthritis in only one foot?
Well, I feel it on one foot more than the other one, but I think it, I think it might be in both feet.
How old are you?
I'm 62.
Okay, my name's Dr. Backish. Pain in the feet.
Pain in the feet is common as you get older because the fat pad atrophies and the fat pad in your foot gets a little bit thinner. So the bones are actually closer to the ground and closer to your shoe. And then your foot size changes too, so you have to adjust as you get older for your shoe size because your feet get a little wider and a little longer because the muscles in between the bones become more lax. So most foot problems are, at least in part, shoe problems. So you have to look at your shoes and make sure they fit properly. The other thing is that with arthritis of the foot, besides footwear, you might be able to put some sort of orthotic in there or some sort of a gel pad that you can get sometimes over the counter.
Oh, yes, he's spinning me for that.
Yeah, that's a good idea. And generally it'll come and go, so it'll come in exacerbations and remissions. Sometimes it feels like arthritis, but if it's near the heel, it can be a condition called plantar fasciitis, which can be which hurts more as you stretch your toes out. But the treatment for that basically is the same thing, orthotics.
I have it above. It's like it's on the top of my foot.
Yeah, it's probably just arthritis. So there are drugs like Advil or these aspirin compounds which are very effective, change in footwear, cushioning, and that sort of thing, which usually is very helpful. Unfortunately, it'll probably come back.
So it can come back, and but it never really disappears.
No, you'll get it back. It'll go away, but it'll come back. But it may not come back for months.
Sometimes a podiatrist can help do orthotics and so on. Where which neighborhood are you calling from? Bath Beach?
Bath Beach.
See, I think you have a lot of good podiatrists out there, so that's another thought.
Thank you very much.
Take care. Have a great summer.
Thank you. You too.
Hi, Rose. The previous caller, Agnante was the name of that restaurant. I recommend 5th Avenue and 77th Street in Bay Ridge. Delicious Greek restaurant. We go down to Mary. Hi, Mary.
Hi.
Mary, where are you calling us from tonight?
Brooklyn, Midwood section.
Midwood. And I bet you have something planned for the summer.
No, nothing.
Nothing. You going to go to the beach?
No, I'm 75 years old. I'm too old for the beach.
What was your favorite beach when you were younger in Brooklyn?
Oh, Coney Island.
You like Manhattan Beach?
Yes,
It's
Manhattan
quiet.
Beach.
I like Manhattan Beach. It was nice.
Yeah.
Nice.
What can we do for you?
Well, I have just a simple question. I'm on hydrocodone for pain.
Okay. It's very serious
pain. And I have cirrhosis of the liver and an enlarged spleen, edema, and COPD, and diverticular. Now, I was just wondering if that medication would harm the liver.
Okay, hydrocodone.
Well, hydrocodone is packaged in a commonly known drug. It's called Vicodin, and that's the generic Vicodin. It's hydrocodone/APAP,
right,
which has Tylenol in it. So that's one of these Tylenol-containing drugs that the FDA was concerned about. And Tylenol is not good for your liver. So
I shouldn't take it?
Well, you should go to the doctor and ask him to give you some other pain medication. If you need pain medication, it's very important that your pain is controlled. So, he could give you a different pain medication without that Tylenol ingredient, which is potentially toxic to your liver, which has already got a problem.
Right. That's what I was afraid of when I heard it tonight.
I'm glad you called about that. It's very important to
I know.
get in there and see your doctors around the neighborhood. You can get in and see him? So
yes.
Get in there and see him, okay?
I'm going to see him July 7th.
And we want to hear from you in the fall, hear how things have worked out.
Thanks a lot.
Okay, have a good summer.
You
And we're now going to hear, I think this is the Larry who we won our furthest call. Is this Larry from Rockland County?
It is, Dr. Garner.
This is you won an award which you'll be getting shortly, a plaque that'll proclaim that you were the furthest listener of the year.
Oh, I'm flattered. I had a little difficulty because they're not on the internet tonight.
Really?
Right. So I had to. I kept dialing the number, and I finally got through, and I told the.
I hope it's not cyber terror.
No. But I had a question for the geriatric physician.
He's right next to us, Dr. Bakash.
Sure.
What's the question?
Dr. Bakash?
Yes.
I'm going to in July 10th. I'm going to be 80 years old, and I, of course, at 80, I'm still very, very physical. But are there any supplements? I mean, I take a one-a-day vitamin, but are there any supplements that can offer me a little more get up and go, a little more, energy?
Well, get up and go, I don't know if there's really any supplements. Probably it's a good idea to supplement your calcium intake because osteoporosis becomes an issue at your age, and vitamin D as well for bone strength. It's important, for you to have enough minerals. I think a multivitamin with minerals would be fine. That would have zinc and other things. But the most important thing is weight-bearing exercise and staying physically active. You sound very young. Yeah. You have a very young voice. I would never have guessed that you were 80 years old. You sound very quick. And to maintain your quick mental status as it is, I think you just got to stay mentally and physically active the way you are. There is no magic bullet, unfortunately, to give you energy.
I listen to some of these radio.
Unfortunately, there's a lot of money to be made in supplements, and there's really no scientific basis for any benefit that people will get.
Like coenzyme 10 or anything?
No. Coenzyme 10 has been touted for use in Parkinson's disease and sometimes in congestive heart failure with weak studies. I mean, they're not really...
But Larry, you don't sound, I'm telling you, very young. We'd like to see the picture when we've never seen you, but the voice does it sound young?
It's a young voice.
So keep up.
I really appreciate that. I can still push a lawnmower.
No, you sound good.
Yeah, and this is the end of your sequence, is it not?
This is the season finale. We'll be back September. I don't know the exact date, but the beginning of September, right after Labor Day.
Okay. So I wish you all well, and I thank you, Doctor, for your comments. I appreciate that, and I'll look at the minerals and see what they do for me.
Thank you. Be well. Thanks. We're getting a lot of requests from the studio audience. They see this model in front of Dr. Gellis, and I just asked quickly, we heard about Billy Mays, right? Had an autopsy, had coronary artery disease. What is that? Can you just show us briefly what coronary artery disease? Just what coronary artery disease is?
Coronary artery disease would be a blockage in one of these arteries that supply blood to the heart. There are three main arteries.
Can the camera see that? Or
my heart needs surgery.
You broke my heart. But if you could lift that, now you can see that a lot better.
Okay. There are three major arteries that supply blood to the heart. The one right in front called the left anterior descending, and then there's one that goes around to the back, and it's called the circumflex, and there's one on the right that's called the right coronary. And these three main arteries, if one or more of them gets blocked sufficiently, not enough oxygen gets to the muscle that the artery is supplying, and the muscle dies, and that's what we mean when we say somebody's had a heart attack.
It's a heart attack. And before it's died, you may get symptoms if you have blockage, but not totally blocked. Is that what we mean? That would be angina?
Yes. Frequently, but not always, there is a type of chest discomfort that people get if they're not getting enough oxygen to a portion of the heart, and we call it angina, and it occurs mainly with exertion or any kind of stress that requires the heart to pump more blood to the body.
And this with nitroglycerin might keep the vessels open?
Nitroglycerin may help the symptoms, but it doesn't cure the underlying problem. The underlying problem is a blockage in the artery.
I see.
And that cannot be cured by nitroglycerin.
But you have ways to do that, but angioplasty,
right.
stents,
There are
and all that.
a number of things that can be done for the blockages, One of the most important is to try to keep your blood pressure controlled, try to keep your cholesterol controlled, get plenty of exercise, eat properly.
Great. Thank you for that demonstration. I hope the audience liked that. Myra?
Yes.
Hi, Myra. Where are you calling from?
I'm calling from the Brownsville section of Brooklyn.
Oh, very nice. Any nice restaurants pop up in Brownsville?
No, I don't think so. You have to go like downtown Brooklyn.
Yeah. What did they do to that? What was that gaslight with the gas lights in Fulton Street?
Gage and Tolner.
Gage and Tolner. Did you
It's
ever
closed,
go?
I think.
That was a nice restaurant.
What was the name of it?
Gage and Tolner. Very nice.
Oh,
old.
downtown Brooklyn. Yeah, but they closed
They
that
closed.
over a year or so ago.
Yeah, some kind of a roast beef place opened up or something, but they Arby's, but they preserved the gas lights and it's landmarked. But,
yes.
Yeah.
Mm-hmm.
So what can we do for you? We're almost to the end of the show. What can we do for you tonight?
I know. I was scheduled for a DNC because I had post-menopausal bleeding.
Okay.
And also my uterus is out of place, and it's supposed to be a mass covering the uterus with blood and urine. I didn't have the DNC because I didn't have the DNC. But now I don't have the postmenopausal bleeding.
Mm-hmm.
But I'm wondering, should I still go through the DNC because of the mass or wait until I start bleeding again?
You came to the right place, Dr. Economos.
Where is this mass?
Oh, okay. When I had the vaginal exam, I was told that my uterus was out of place, so they did a sonogram. The sonogram showed that there was a mass covering the uterus, and the mass was full of fluid and blood, so that's why I was going to have the DNC. But it was a problem with me calling in to verify, I think, that I was having the DNC at the scheduled time, so we didn't do it. It was for last month. So I'm wondering, since I don't have the bleeding, but because the mass is there, should I go on with the DNC?
Yes, you should, because sometimes the mass may grow in such a way where it blocks the release of the blood, or if as you get older.
I'm 58. Mm-hmm.
As you get older, tissues start to dry up in the vaginal canal, and that can cause the cervix to close. So the fact that your bleeding went away, while seemingly encouraging, it doesn't take away the fact that you did bleed before and that there's a mass. So I would go ahead and try and get that DNC done.
Thanks, Dr. Economos. Thanks, Myra. Have a great summer.
Okay, thank you.
Okay, you know, we have, again, 4 lines flashing, and unfortunately we've come to the end of the show. I can't believe it. Not only the end of the show, the end of the season. And this is the end of the 8th season of Ask the Doctor. I'd like to thank Dr. Catherine Economos, Dr. Emil Bakash, and Dr. Jeremiah Gellas for coming in. We hope we were able to help you. It is good to remember that you should be proactive about your health. Speak to your doctors about your concerns. Go for second or third opinions. In the meantime, continue to watch every Tuesday night or visit the website at netny.net/askthedoctor. There you can catch my video blogs, see past episodes, or send in questions. Thank you for all your calls tonight. I'll see you again in the fall with brand new episodes. Goodbye, stay healthy, and I'll see you in the tablet.